This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. It's kind of a mixed bag out there today, but I'm here and I'm waiting to take your phone calls. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem. Guess what? You've tried, you've looked, you've applied, you've done all those things that you thought that were right, and they turned out not to work. So here's an opportunity. Let's look at them from, a platform of no drugs, no surgery, and see what we can really do that allows your body to turn itself back on and really work it back into a place it needs to be. 888-630-9625. Have lots of things to talk about. And see, what happens is when I get a break from the office, I actually only worked a few days last week. I took both weekends on either side. It was kind of great. My family went down to South Carolina, Pawleys Island. I drove down, and there was 20 of us, 2 different houses. It was like over the top. It was craziness. But anyway, I can handle 3 days, and then I go home, and then I handle 3 days more, and then I came back. But we really had a good time. The kids were fun. They, can outrun Grandpa now, and it's an embarrassing situation, but nevertheless, it was, the brain's working, and I got lots and lots and lots of things to share with you. But one of the things I want to share with you is something that has kind of come out in the marketplace recently. And guys, you got to pay attention to this, and it's in the lines of anti-aging research and all those things about genetic maps and makeups and so forth. But it has to do with a certain hormone, and one that I've been telling people about forever, and everybody wants to run out to the health food store and buy this thing, but you have to understand what happens first. We've talked over the last many, many years about the relationship between prostate cancer and breast cancer, and what we said is that genetically the tissue is the same, and subsequently as the exposures to xenoestrogens, your environmental estrogens, go up, you have a greater susceptibility to prostate and breast problems. Okay, so all the studies, all the epidemiological studies and the setups for research and experiments and so forth have come to a conclusion that they said there is a hormone that plays a very significant role in very severe cases of prostate and, by the way, also breast cancer. And when this hormone is low, then the risk of really bad cancers in both areas go crazy. They go through the ceiling. So the American Association for Cancer Research published an article. The Prostate Cancer Foundation, also in conjunction with these folks, published an article, a research finding that said low melatonin is linked to the advanced prostate and breast cancer scenarios. So what does that mean? What's melatonin? Where does it come from? Well, melatonin is something that's produced in the brain. It's produced actually as a result of the regulatory process of a little pea-like shaped area of your brain called the pineal gland. And the pineal gland is this orchestrator. It tells everybody what to do when it comes to hormonal function. But melatonin plays a huge role in regulating your sleep-wake cycle. A lot of you who can't get to sleep, a lot of you who wake up once you get to sleep, melatonin often has a relationship either directly or indirectly. The problem is that as mammals are made, you're supposed to sleep in complete blackness. When you go to bed at night, your room needs to be black, it needs to be slightly cool, And if you have those things there, at least you have the environment that will allow you to sleep and go into profound, deep sleep. But if you're sitting there and you have ambient light bleeding in through your windows, if you have digital displays, either your computer screen still on or you have a clock in your room that's out there, you have light leaking in underneath your door from another area, your room is not black. And so subsequently, this whole regulatory mechanism over a period of time is going to end up in trouble, and subsequently you're not going to sleep well and your immune system's not going to fire properly. But downstream, if you will, there's a strong association between this, what we call 6-sulfate-oxymelatonin, and the increased risk of advanced prostate type of cancer. So melatonin and prostate cancer have this interesting relationship. And I want to talk about that a little bit. And guys, what you can do, and ladies, what you can do to make a difference without going to the health food store and buying 1, 3, 5, 10 milligrams of melatonin and taking it every night. In some situations, it's necessary to regulate the process. When you go from cross continent, this United States to Europe, from Europe to Asia, whatever, or back and forth, and you're constantly disrupting the sleep cycle, because when it's 3 o'clock in the morning here, it's like 9, 10 o'clock in the morning someplace else, or midday, and you have to adapt because of business purposes, or just because you're, traveling crazy person like many people do around here. But melatonin and cancer, particularly prostate cancer, is a significant relationship. The researchers conducted tons of studies, and they did it in an interesting area of the world. They did it in Reykjavik, in Icelandic area, and they collected the first morning urine samples of these guys up there. And they found that 1 in 7 men reported problems falling asleep, and 1 in 5 men reported problems staying asleep, and almost 1 in 3 reported taking sleep medication to kind of filter that through. So when you look at the whole overall playing field, these guys don't sleep up there. And they don't sleep up there because the regulatory mechanism of night and day isn't what it should be, and there's a lot of other things that go into that. But I'm trying to give you the thumbnail on this. But men reported taking medication for sleep problems and falling asleep and problems staying asleep had significantly lower levels of melatonin compared with men who didn't report any sleep problems whatsoever. So during the study, and it wasn't a great study, it was like only 111 guys, and these 111 men that were diagnosed with prostate cancer, and they had to say that they already had cancer, including 24 of them with advanced disease. The researchers found that the men whose melatonin levels were higher than the median value had a 75% decreased risk for that prostate cancer advancing and metastasizing and going to many other areas. That's huge. That's significant. Additionally, 31% decreased risk for prostate cancer overall was observed in men who had adequate amounts of melatonin. So this melatonin sleep cycle prostate cancer kind of, goes hand in hand, and we're looking at a natural body rhythm, a natural body what's called a circadian rhythm. It's almost a pacemaker, and it's located in the brain, in the area of the hypothalamus, another little area, but also has to do with this pineal gland, which actually releases the melatonin. But the melatonin cannot be released unless you're asleep. And you can't go to sleep and stay regulated if there's any kind of light that filters in to your area. Now, sometimes you got to kickstart the mechanism, and you have to give 1 or 2 or 3 milligrams of melatonin. There's reasons for that. And when we're dealing with melatonin, we're dealing with things that are very specific as far as the regulatory mechanism, all these things. There's a lot of experimental studies that are out there on how melatonin inhibits or slows down tumor growth, and the evidence is kind of applaudable. It's interesting. But where there's suppression of melatonin because of constant light exposure or because of the pineal gland was taken out, and they did that in rat studies and animal studies, it dramatically increases the rate of any kind of tumor formation, but particularly in cancer patients and or animals who had cancer. So the anti-cancer effects of melatonin can be explained as a result of the modulation or the balancing of this pathway that produces melatonin and it's as a result of a huge, huge antioxidant activity. And we can go on and on and on and on, but it's out there. It seems to be that everybody's getting on the bandwagon on this thing. I don't want you to go out and buy melatonin. What I want you to do is check your environment. First, see if, 1, your room is black. 2, that it's cool in your room, that you don't have any kind of ambient light filtering in under the door, through the windows, off of computer screens, and so forth. The other piece is that they're finding that if you're on devices of any kind, we're going to talk about devices later on in the program, that you're going to have more problems with what they're beginning to call programmed cell death, and as it has to do with DNA regulation of these areas of the hypothalamus and pineal. It's an interesting field, and it's one that we really have to pay attention to, and this is going to kind of segue into a conversation that I want to have with you today about devices. And, if you have any of your kids around, or any of you are addicted to your computer screens or your cell phones or your iPads, pay attention, because I think you're going to find what we're going to talk about as the program goes through especially interesting. And you may sit back and say, oh my God, I'm addicted and I got to really do something about it. Yeah, you do, because you're causing some huge, huge problems. Before we get into all of that and kind of shed some light on it, remember we're here at 888-630-9625. Also, I'd like to remind you, October the 18th, what's that? It's Ageless Health 2014, a day that you will not soon forget. Go to our website. Go to rosellecare.com. That's ROSELLECARE and .com, and then scroll down maybe about a third of the page, and you're going to see all the information that you need. Join me. By the way, it's October, right? And we're already almost 60% full. So don't delay. Give us the opportunity to educate you, to show you how you can take control of your own life, how you can make a difference in everything that goes around you. This is a day it's phenomenal. Trust me, you're going to go away with so much information, the ability to apply it the very next day. You're going to be entered in a $1,000 drawing for healthcare. Amazing, right? We're going to do some great things. We're going to provide an organic lunch. You're going to see a Tai Chi demonstration. You're going to be able to sit and talk to our docs. It's a day that is compressed and packed and jammed. Join us. Let's go to the phones. Rose, thank you for being so patient. We got a couple of minutes. How can I help you?
Well, I wanted to get your opinion on what I'm going through. I went to see my doctor because I had tenderness and swelling in my left leg that turned into pitting edema from my knee down to my toes. And to figure out why this was happening, they did all kinds of tests to make sure it wasn't a blood clot, it wasn't venous insufficiency. They did an ultrasound of my heart that was fine. They started doing CAT scans with contrast. Turns out they couldn't find anything, so they're treating me for lymphedema with a compression sock and Lasix.
Rose, how old are you?
I'm 42.
Yeah, you don't sound like someone of the age that should have that type of problem. That's why I stopped and asked you. Go ahead.
And then during the CAT scans, they found spots and it really enlarged lymph nodes in my lungs. And they were concerned, so they did a needle biopsy, which was negative.
Rose, both sides or just one?
I'm sorry, say again?
Both sides of your lungs or just one?
Both.
Okay.
Both sides. So they did the needle biopsy, and it was negative for cancer and negative for sarcoidosis. So now they want me to go see my rheumatologist again because they think it's some sort of autoimmune lymphadenopathy that they think is related to the rheumatoid arthritis.
But the swelling is still one side, right?
In my leg?
Yes. Okay.
It's
all right.
only on the left side from my knee to my toes.
Okay. And have they done all kinds of cardiac testing and
yes,
echocardiograms, and all of that's fine?
Yes.
All right. There's a lot of different things that you can deal with. I'm going to ask you some quick questions because we're coming up. I'm probably going to hold you over because this is very interesting. First question, any injuries over the last couple of years, car accidents, falls, you hit your head, did you fall, did you hurt your shoulder, did you hurt your back, anything like that?
I did. My giant German Shepherd, I slipped and sprained my neck.
Okay, and has the neck problem still persisted where you've lost range of motion, soreness on turning, anything of that nature?
No, I get kind of like a lump where my back turns into my neck after a long day of work that's really sore.
Okay, so you still have problems. That's real easy to answer. Any numbness or tingling in your hands?
Nope.
Okay. Any loss of strength where you go to lift something or turn a jar or pick something up or raise your hands over your shoulders?
No.
Rose, hang on. Don't go away. I got a lot more questions for you. I got to take a break. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you. We have Rose still on the line. Rose, are you there?
Yes, sir.
Okay, so let me give you a little insight, and then I'm going to ask you some more questions. Anytime that you have pitting edema in the legs from the knee down, you have to think cardiovascular malfunction. Doesn't mean pathology. Now, there's a difference. It means that the system is not returning lymph the way it should. So you have an injury, and the reason I asked you about the injury and affecting the neck and shoulders is simply this. The upper part of the back, the first and second thoracic vertebrae, house nerves that go to the heart and go to the lungs. Then in the brain, you have a nerve called the vagus nerve that comes down through the neck, and one of the first places it goes is to the lung, and it goes to the heart. Now, at your armpit level, on both sides, you have something called the portal duct. The portal duct is the main dumping duct of lymphatic congestion and flow. So in many situations, and we've seen it time after time after time, where somebody has a problem with the nervous system, the spinal cord mechanisms. You have 31 nerves that come off the spine. They divide. One branch goes to muscle, and the other branch goes inside to the organ. In this situation, it can be lymphatic, it can be the heart, it can be the lung, or all those things. My guess is they're all involved. And on that side, on the left side, you're getting compression of that portal duct, so you're getting stasis, which means that the lymph system at the lower end can't return in that area, and so you're going to get a mechanical restricted mechanism that has occurred because of neurological injury because of the problem that you had with your dog. So that's one very specific situation. Now, the lymphatic channels are also kind of promoted in doing their job properly by iron levels and vitamin C levels and B12 and folic acid. So these are things that you would check as well. When you end up with congestion in your lungs and you have these lymphatic nodes that they're starting to see, and they go in and they do biopsies and they come back negative, it's because the body is trying to lymph channels, lymph nodes are trying to protect you as well. So you have all this debris that's not draining out that your body can't get rid of and dump into that lymphatic system, dump into that portal duct area. All of these things go hand in hand. So it's not just one simple, straightforward thing, but they're all mechanical. They're all neurological or neurochemical as it relates to nutrition. So you have to start taking the layers off and start looking at this stuff as why did it happen in the first place? You know, they've ruled out pathology and heart disease. They ruled out cancer and sarcoidosis. You have an underlying rheumatological problem, but that is also part immunological response, which comes from the nervous system, comes from biochemistry, and by the way, the end piece then ultimately is stress. So you look at those things, and we see many patients that present this way, and they go through the medical chase, the normal allopathic chase, and they come up with nothing, and then pretty soon they use medication to treat these symptoms instead of handling the problem and the underlying situation. Does this make sense to you at all?
It does, because I am so medicated right now.
Yep, absolutely. And the problem is that you're going to have one on top of the other, and then the medications have their side effects, and then pretty soon, because of the medications, you're going to have pathology. Your body's going to break down. See, here's what happens. In a normal human being, okay, we're born and we should have the capacity for function, normal function, at least if there's not any immediate genetic pass-throughs. And then we're exposed to injury. We're exposed to, the aberration of diet. We don't eat the way we're supposed to, or we're getting things in our body we shouldn't, or we're being exposed to our environment and the like. And then we stress like crazy. But nobody really teaches us how to deal with these things appropriately. And then we end up with something called symptoms. I don't feel good. I have lymphedema. My joints are stiff. And we're never educated on how to take control. That's one of the things that prompted me to write my book, because we don't know how to do these things. Then we go on, and if we go to our doc for a longer period of time and we keep complaining of all these things, what do they do, Rose? When you go in and you complain, what do they ultimately give you?
Stress medicine.
Yeah, medication, right? Good. So, and then the medication covers things up, and then but you continue the process onto pathology, and then now you have the demonstrable things that start to show up. And you've got to stop it. You've got to understand the process. You've got to ask the right questions. And then you have to encourage the repair system of the body's innate capacity to resolve things. And it's done every day. So when I hear things like, my leg is swelling on the left side, I hurt myself, I've had problems with this. They've told me I've had problems with rheumatological stuff. See, I'd go back and ask you, when was the very first time you ever were injured? Ever. What happened? How was it adapted? What did you do after that? How has it progressed? What was your diet like? What's your stress load like? And then I'd put together all these things, and I'd look for the areas that your body begins to fail at, meaning you can't return the lymph system the way you should. You should be able to do other things that you're not able to do, but we're covering them up now with medication. And at 42 years old, Rose, you should have your life. You should be able to put it together. I would love to be able to pick this apart for you. If there's anything that I can do, you can send me a note, and I'll go back and forth with you on email if you'd like. You need to do more, hon.
Okay.
Okay?
All right.
Thanks for calling. Appreciate it.
Bye.
888-630-9625. That's 888-630-9625. Let's talk about those devices, those iPads and cell phones and computer screens and all of those things that, you shouldn't be dealing with. But we'll do that when we come back from the break.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You listen to Dr. Tom Roselle Live. I'm in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. Doesn't make any difference what it is. Let's figure out what's going on with your health and make a difference, something that you could actually do. Like to find me off the air, go to rosellecare.com. That's ROSELLECARE.com. Send me a note, and we will get back to you. If you'd like to talk to one of my doctors before that, 703-698-7117. That's 703-698-7117. Tell my staff what the problem is and that you'd like to talk to somebody, and they will get back to you. They'll talk to you and find me. Do it by email. It's faster because I answer my email generally within a very short period of time, meaning a week. Sometimes it gets overloaded with all the stuff I do and it gets shut down, but I think that's somebody trying to tell me to take a break. 888-630-9625. Paying the price for going mobile, all your devices, right? Your cell phones, your iPads, your computer screens, all that nonsense. Well, here's the deal. 60% of us who do all these silly things, we can't put them down. We're in our car, we're holding on the wheel, we're texting with one hand, and extremely exposing ourselves to injury. Well, 60% of you experience some form of health problem due to technology, and it's not a good thing. Everything from eye strain to back pain to neck pain to headaches to wrist problems. And guess what? Insomnia, as we talked about earlier with melatonin, it's one of those things that can disrupt the HPA axis, which is hypothalamus, pituitary, and adrenal, your stress patterns. That ambient light, that constant flickering of your pixels are going to cause havoc in your brain pattern, and so subsequently you can't focus. But most of these conditions that affect the musculoskeletal system are seen by guys who, that do the kind of work that we do in our office, chiropractors, osteopaths, physical therapists, and so forth. And the problem is that they don't stop to think of where this is coming from. Effective treatment must include some attention and some mediation of working with these things. Now we've got this thing called texter's neck and texter's thumb. We had carpal tunnel syndrome and repetitive stress injury. Now we got the thumb problems. You guys are getting big knuckles on your thumbs, particularly kids. They sit there and they're, have you ever seen a kid with an iPhone? You got them to my house, and if, you have an iPhone at the house, I don't let you take it to the dinner table. If we're sitting there having a conversation, it's not going to happen so good, right? So, but anyway, according to the Journal of Occupational Safety and Ergonomics, 53% of smartphone users suffer from neck pain. So you want to get rid of that chronic, dull neck pain, and you can't bring your head back anymore. You can't look up the way you want to. You better stop doing something with your phone. Another study said 84% of users had some sort of pain in at least one part of the body, and you add that onto other health issues. And here's the other thing that we don't think about. Now, we're talking about mechanical problems, and they're very real, and we see them all the time, and we see patients that come in with degenerative diseases. But above and beyond that, you got a laptop, and it's sitting on your lap, or you have an iPad, or you have a mini pad, or you have your cell phone, and you're sitting there and you put it on your lap, or you're at a meeting, and you're trying not to let anybody see that you're texting, or you're in the movie theater, even though they tell you to turn it off, you don't. It's definitely worth noting that these radio frequencies, these waves, these low-volt waves, are starting to cause huge problems. Guys, your sperm is being altered. It's actually mutating into stuff that you can't get somebody pregnant with. Your testosterone level is being destroyed because the testicles are the things that, when you're a young man, produce the greatest amount of testosterone. Ladies, your ovaries and your uterus and so forth are being totally hammered by these low-volt waves. Subsequently, you have an increased risk towards other things. These are also called, by the way, xenoestrogens. And we already said that estrogenic effect on breast tissue and prostate cancer are huge. And guess what? Increases your risk of deadly types of cancers. So if you don't want to stop and stop it because of your thumbs and your wrists and your neck and your back, start thinking about the cancers that these things are forming as well. Tremendous amount of information that's out there now. Don't ignore it. Even your cell phone companies are starting to put little black box warning labels in them that these things have been known to cause brain tumors. So you get them up to your head and you think, well, I don't have it up against my head. But you got these earplugs that are going on, or you have these remote plugs that you don't have to have your cell phone next to your ear, and they walk around all day long. Do you think for 1 minute that it's not causing a problem? Think again. You've got to do something to help that. Al, how can I help you, sir?
I've been diagnosed with enlarged prostate. Urologist has prescribed a medication called Rapaflow, 8 milligrams.
Yes.
It helps very little, and I still keep getting up at night and have an urgency to use the bathroom. I was wondering about some of these natural things I see on TV that they're even giving away.
Be very careful with what they're giving away. Some of the stuff works, but you also can be allergic to some of the herbs that they're using. Saw palmetto, S-A-W, palmetto, P-A-L-M-E-T-T-O. Saw palmetto has been known forever to help prostate function, and the tinctures are the best, but you want to get one that's clean, an organic form of the saw palmetto tincture. You can take it without any problem. What you would notice if you had an issue with it is that you start getting a little stuffy, or your joint spaces would hurt a little bit. It's doubtful. Generally, it's just not going to work. But go to any of the health food stores, give it a try. Use the concentrated tincture form. Make sure that it's organic. Add that to zinc sulfate. The sulfate form of zinc is the most important and the most active form when it comes to the prostate gland. 50% of the dry weight of the prostate is zinc. Now, what happens over a period of years is because of stress and immunological function and so forth, we burn up our zinc and we fail to replace it adequately. So we end up with swelling, hypertrophy of the prostate. Alanine is an amino acid that works very well in shrinking it down. There's tons of things. We can even talk about pomegranate juice. Concentrated pomegranate juice has an effect on the prostate. But I'd have to know a whole lot more about your health and your immune status and your inflammatory levels. My mantra, as you've heard me say, avoiding things like sugar, sodas, coffee, teas, fast food, fried foods, gluten, additives, preservatives, all of those things cause swelling in the joint spaces and subsequently in soft tissue like the prostate and in lymphatic channels and so forth. Eliminate those things and see if they makes a difference. Any kind of meat, regardless of what it is, particularly pork, has an effect on prostate and breast tissue. You have high levels of arachidonic acids that build up in the body, and if you're eating a lot of grain products in addition to and not a whole lot of fruit and vegetables, but particularly vegetables, then you're going to be much more predisposed to this type of situation. So try the saw palmetto, try the zinc, eliminate some of the things that we just talked about, see if it works for you. There's many other things that are there, but I'd have to know more about you. So send me a note after 30, 45 days of trying this, and let's see what I can do to help you.
Thank you.
Appreciate your phone call. Bernice, how you doing, kiddo? Good to talk to you.
Oh, fine. I have a question. My 89-year-old friend, she's a woman, and she fell about maybe 6 months ago, and she hit her knees, and so her knees have been really bothering her, and the doctor doesn't really want to do anything for her, other than surgery, and she doesn't want to go that route because she's diabetic. So would spirulina be a good one just to get her health back? And I want to give her one vitamin because she already takes a few, but she doesn't take really good vitamins. So what whole food vitamin could I give her? Would it be spirulina that might help her? You
got to be careful with spirulina. A lot of people are allergic to it.
Oh, are they?
Yeah, and it has a lot of good things into it, but I would go to, a good health food store there, ask them for an organic form of a natural vitamin that has medium levels of calcium in it. We don't need as much calcium as we had thought 10, 15, 20 years ago. But you want to make sure that it has all the trace minerals. You want to make sure that it has all the vitamins at low levels. And you want to give it at each meal so she has a better chance of digesting it. I would give her a low-level proteolytic enzyme, the amylases, the bromelains, and so forth, that will also help her digest those things. I would give it to her outside her meals. Don't give it with her meals, and because then it'll help decrease the inflammation in her knees. Acupuncture is great for somebody that age and would be able to help and mend and repair the joint spaces. But if you start with that, give her minerals, increase her water, make sure her body stays alkaline. The old tried and true using apple cider vinegar, Bragg's organic vinegar in the morning on an empty stomach, 1 to 2 tablespoons in about 8 ounces of water. Give that a try. See if it doesn't loosen up the joint spaces for her a little bit. If she complains starting that regime within 24 to 48 hours, if she complains about things being worse or other symptoms, stop that, because sometimes people are sensitive to apples and vinegar and fermented foods and so forth. And one size doesn't fit all. There's an interesting book that has been around forever. It's called Back to Eden, E-D-E-N, by Jethro Kloss. He's an old naturopath. This book is probably 40 years old, and it's been reprinted and republished many times. It gives you some natural things to do in different types of situations. Again, not one size fits all, but at least it's a reference. It's a place to go.
Yeah, she has no gallbladder, so I think she doesn't like the taste of a lot of stuff. Like liquids.
Sure.
So that's another thing.
Sure. So you have to give her enzymes. Anybody that's had their gallbladder removed has to take digestive enzymes the rest of their life.
Yeah.
Because the gallbladder is no longer able to produce the bile, which is necessary to help emulsify and break up fats.
Is digestive enzymes, is aloe vera one?
No, aloe vera is an emulsiogen, and what it does is it helps heal tissue. So if anybody has an irritation, they've got people who have GERD, we often will send them to the store and put them on herbicide. Aloe and try to get them off of Prevacid. See, the problem is when you've been on GERD medication for any length of period of time, it stops the body from producing the natural barrier that's around the stomach. So now when you do produce your own acid, which you do need, it burns like crazy. So you can't just stop. You have to use these mucilagens, and you have to change the dietary patterns, and then slowly, over a period of time, do you begin to see if the patient can begin to back off their GERD medication. So any of these protein pump inhibitors, are dangerous, and because they stop the absorption of all kinds of things. But anyway, Bernice, give that a try. You have my email. Send me a note and let me know if I can help you in any way. 888-630-9625. All kinds of little things that we're talking about, and we want to make sure that you take control. I mean, it's really up to you. It's all about what you do with your health. One of the things that we fail to do is recognize how the structural system of the body really affects everything on an ongoing basis. I want you to consider for a minute. All of us have driven a car. Most of us, probably 98% of us out there, have driven automobiles. And sometimes we put up with things, okay? So we don't pay attention to our wheel balance, and we should all the time. So if you don't have enough pressure in one wheel, then the body of the car is going to shift, right? And then if you leave it that way for a long period of time, now it affects the alignment and affects the balance. And pretty soon it affects the structure. And now you have other things that you get shimmies and shakes and rattles and rolls in that car that you didn't have before. Well, the body is the same way. When you have a little problem, either in your ankle or in your back or your foot, and you don't take care of it, you put up with it, you take something to deal with it, what happens is your body adapts to it, and you end up with compensation patterns because of the pain, because of the lack of capacity of that one area. The body compensates and adapts. The body moves differently to avoid the irritation, to try to make up for the loss of strength. Unbalanced motion causes muscle weakness. Injury causes unbalanced motion, causes muscle weakness, which causes more unbalanced motion, which causes the body to begin to break down. We deal with that all the time. There are so many different subtle things where little problems ignored over a long period of time are going to cause major, major issues as time goes on. And that's one of the things that we're going to deal with, by the way, at the Ageless Health Seminar in October. We're going to show you how that happens, but more importantly, we're going to show you how to take care of those things. We're coming up to a break. Unfortunately, we're coming close to that time of the show again. Don't go away. You're listening to Dr. Tom Roselle Live.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here every Sunday, 12 noon, bringing you the most cutting-edge and intimate information on natural health care, from chiropractic, acupuncture, nutrition, and all those other things that you didn't know who else to ask. Well, I'm the guy, 888-630-9625. And if you'd like to reach me outside the program, all you have to do is go to rosellecare.com. That's ROSELLECARE. And send me a note, and we will get back to you if you want to talk to one of my docs beforehand, 703-698-7117, and tell them that you'd like to speak to somebody on whatever the subject is, and we'll be more than happy to get back. Don't forget, October the 18th, a Saturday, Ageless Health 2014, a day that will change your life forever. I promise you, if you come and you listen and you pay attention and you ask questions, this will be a day that could be the turning point for everything that you possibly wondered. What can I do without drugs? You're going to learn about the different blood tests and different laboratory tests that you need to ask your docs about. You need to take control of your life and understand how little things grow into big problems. You're going to learn about nutritional patterns that, if you adapt slowly over a period of time, can truly, truly resolve so many different problems. This is the day. Go on our website, rosellecare.com. Go down about a third of the page. And by the way, if you want to save a little money, do it now, because within the next 30 days, price goes up to full speed, and that's that. Let's go to the phones. Paul, thank you for calling. How can I help you, sir?
Yes, hello, Dr. Tom. I read a book about 40 years ago by Adele Davis, and I'm 63. I have an enlarged prostate, and I remember she said for a prostate, a lot of in some countries they eat pumpkin seeds.
Yep.
They don't have as big a problem with prostate problems. Can you comment on that? Were they fresh pumpkin seeds? Were they toasted, or what can I do?
No, they're fresh pumpkin seeds, but that's just part of the pattern. If you go to these countries and you find that they're doing things naturally, pumpkin seeds and sunflower seeds and things of that nature all have certain amounts of trace chemistries and nutrients that support not only prostate function but all kinds of different things. But you're also going to notice that in these countries that their dietary patterns across the board are very different than ours. And we get into trouble in this country because of the GMO foods, the manipulated foods, the foods that have been refined. I'll give you an example. I'm first-generation Sicilian. And when I go back to visit my father's village, the foods that are there are so different. The tomatoes taste differently. The vegetables have a flavor that we don't have here because we've so stripped our soils of all kinds of things. They have volcanic ash that they're growing in. Sicily has a volcano called Mount Etna, and that's what that whole island is made from. And you'll find that in other parts of the world, too, when you go to Turkey, when you go to Greece, when you go into the central portions of France where things haven't been modernized, if you will. Foods are very different. But having said that, pumpkin seed is something that is very, very important across the board for a lot of things. You can do it with pumpkin oil. There's a concentration of that, but it has high levels of manganese and zinc, which we were talking about, and it has significant amounts of protein per weight. It has trace amounts of copper in it, and all these things are helpful to the prostate. So if you get pumpkin seeds, if you use sunflower seeds, if you get organic nuts, particularly walnuts and so forth, it can make a difference. I got to go. We're right at the end of the program. I'm sorry I have to cut you off.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Bye.